You very much. Good morning, afternoon, evening, dear friends and colleagues. Thank you for giving me the opportunity to speak. It's real pleasure to be with all for this webinar. First of all, I would like to thank the organizer of this webinar, including experts in different domains and from different countries. The theme of World Diabetes Day 2020 is the nurse and diabetes. The campaign aims to raise awareness around the crucial role that nurses play in supporting people living with diabetes. Diabetes is chronic disease affecting millions of people around the world, and it's recognized as an important cause of premature death and disability globally in the Eastern Mediterranean region. Many countries in the region are struggling to meet the healthcare needs of people with chronic disease, and people living with diabetes are more likely to experience catastrophic health expenditures. As you know, COVID-19 pandemic has imposed challenges to the provision of care for patients with diabetes and taught us how vulnerable our systems are in terms of preparedness, and nurses have a crucial role to play in supporting people affected by diabetes, and the role of nurses is becoming more important as part of the multidisciplinary health team in managing the impact of the condition. The larger, stronger, and better trained nurses, the more significant their contribution would be in the prevention, early diagnosis, treatment, and management of diabetes. For diabetes communities, the year to come will also offer a window of opportunity, as 2021 will be the 100th year anniversary of the discovery of insulin. A century after, insulin and diabetes care are still affordable for many, especially for poorer households. To improve the health and well-being to diabetic people and save their lives in our region, IDF Mena, with International Council of Nurses and WHO MRO, are committed to take this agenda forward jointly to increase awareness on the competencies and functions of nurses in preventing, controlling, and managing diabetes, and to improve capacities of nurses in managing diabetes. Thank you for your attention.
Thank you very much for giving me the opportunity to share that important session, and I'm really happy just to see this initiative coming to be real. Next slide, please. Well, I shall not repeat what has already been mentioned, but I would like to stress on the shortage of nurses in quality, and now let me tell you about the collaboration between IMRO and MENA. This is a meeting which, next slide, please. This is a meeting which had been held 7 years ago, actually, between the MENA region and the IMRO office during my term as a chair of the region. And for some logistical issues, we could not continue it. There had been an agreement on a collaboration agreement, actually, and I waited it to be continued, but now it's time for it to be continued. Next slide, please. The collaboration, we are reviving the previous attempts, and when we restarted now, we agreed to start with collaboration during the World Diabetes Day, and we agreed about a number of activities. Most of them were just a ceremonial way of collaboration, but regarding the nursing issue, it was different. Next slide, please. The nursing issue, it was different because the healthcare system has to be proactive and should never wait until people living with NCDs and diabetes deteriorate because of the NCD care disruption which happened in the COVID-19 pandemic. And because nursing is a very important pillar in the NCD healthcare, and the need of nursing is of particular importance when we have something like the COVID-19. And because the role of nursing in prevention, education, and management of NCDs in general, and diabetes in particular, should be clearly defined, and challenges to be met and gaps to be covered until nurses are fully practicing their role. Next slide, please. This is how the nurses can make the difference. It's for diabetes prevention, tackling the risk factors for type 2 diabetes, early diagnosis of diabetes to ensure prompt treatment, providing self-management training and psychological support to the patients, and particularly the use of technology. Next slide, please. Well, I shall not discuss that. Actually, it's present in the concept note, so I shall pass immediately, for the sake of time, to the way forward. Next slide, please. We in the MENA region believe that we have to start by forming a committee. That's the practical steps we have to do actually to implement this initiative, by forming a committee from the three organizations to plan and implement the initiative. And it will be up to this committee to study the best practices of nursing work and agreement of the standards which are needed to be achieved in the region. Next slide, please. Then data collection. I believe that we have to assess the nursing situation in the region through a group of surveys, including different stakeholders, nurses, physicians, healthy policymakers, and the public. These nurses should be designed to identify the gaps and the challenges which are needed to overcome. And we have to start by choosing a number of countries from our region which are well representing the regional discrepancy, basically regarding the socioeconomic status of different countries, because we are not the same in our region. Next slide, please. And then we have to design the actions required to face the challenges and to cover the gaps in the form of education and training. Basically, these actions will be different from one place to another. So the implementation should, next slide, please. The implementation should involve ministries of health and WHO focal points in these regions, in addition to other stakeholders in the nursing issues in the involved countries. Every country has to adapt these actions according to its own characteristics and requirements. Evaluation of the results in different communities and trying to find out the best case scenarios, stories of success and challenges met, and so on. Next slide, please. Finally, we shall have a document, I believe, which will cover the best case scenarios in different places. I strongly believe that this document will be very beneficial, not only to countries in our region, but to communities everywhere. Thank you very much.